How does the Ayurveda approach joint pain conditions? Right treatment begins with right diagnosis. So, Ayurveda makes the effort to go beyond the anti inflammatory treatment of joint pains to focus on the specific pathophysiology underlying that inflammation. There is two main categories that I see. One is the Vata Rakta category, in which the blood tissue is vitiated or aggravated through various lifestyle and diet factors, and in turn causes increase in inflammation that target joints. In another category, which is the Amavata category, eating toxic foods or maldigestion causes buildup of toxins in the blood that end up in your joints, and therefore the immune system target the joints and connective tissue. Why do joints get targeted by inflammation? This is because joints are spacious. Spaciousness allows for mobility and flexibility of joints. Also, joints don't have direct blood supply going into the joint space. Rather, blood flow goes around the joint capsule, and nutrition going in and toxin coming out happens passively through diffusion. Because of this passivity, when toxins start to become collected in the joints, it is hard to get rid of. To help out, the body causes inflammation to break down those toxins and get rid of them. When the flow of toxins becomes excessive and overwhelming, inflammation also becomes excessive and chronic, thus resulting in chronic joint inflammation and chronic arthritic pain. Let us focus on the blood-borne category of joint pains. This is the Vata Rakta category. Blood is a seat of red blood cells, white blood cells, as well as variety of energetic and oxidative molecules. It is where nutrition comes to all the tissues and where toxins goes out of the body. Blood is a very metabolically active system. When there is acidification of blood, which can happen through eating too much sour acidic foods, overactive and excessive energy metabolism, this can happen because of not getting enough rest, or even because we are having aggressive, angry, irritable, frustrated thoughts, all result in inflammation in blood. This inflammation in blood then translates into joints. The inflammation in blood will naturally cause a lot of irritability and cause a lot of harm to the various visceral organs that look in the body, starting with the heart and the brain. So body does its best to protect them and puts the inflammation or inflammatory factor in the safest places possible, that is away from this major organs and into the joint spaces. This buys the body some time to deal with the toxin and get rid of it through inflammation. Minor inflammation results in aches and pains and stiffness, but chronic and overwhelming inflammation results in arthritic changes. Let's talk about the toxin-borne category of joint pains. This is the Amavata category of joint pains. Ama means physical toxins that are in the body or in the blood. These physical toxins are minute. They are formed from maldigestion of our food. This maldigestion can happen because of having low metabolic capacity or digestive capacity. That can arise from a variety of reasons. The other reason is by eating toxic food, which is very common in modern times. And eating toxic food naturally results in toxic molecule formation in the body. To protect our vital organs, these toxins are hidden in the joints. And if the body can keep up getting rid of them, these joints might have some achiness, stiffness. As the body, in its intelligence, collects toxins away from the vital organs in the joint, It also tries to use inflammation as a way to break down those toxins and get rid of them. When the supply of toxins becomes excessive, overwhelming, and chronic, inflammation also becomes excessive, overwhelming, and chronic. Body cannot repair. Sometimes the body not being able to keep up with repair result in joint degeneration and arthritis. This results in the ama vata category of joint conditions. These are often the rheumatoid arthritis and other types of connective tissue conditions like lupus, like fibromyalgia.